We now go to our reporter Laura Windsor, who has some facts on Parkinson's disease.
In the United States, almost 1.5 million people are affected by Parkinson's disease, and worldwide, about 6 million. Most individuals who develop Parkinson's disease are 60 years of age or older. We spoke with Dr. Bhupat Desai of Pomona Valley Hospital Medical Center to learn the symptoms as well as the treatments to manage this disease.
Parkinson's disease is one of the neurological disease. It's a part of what is called movement disorder. So normally when we move, everything is controlled and regulated by the brain. So in this disorder, that part of the brain, at least small part of the brain, that slowly deteriorate, meaning brain cells dies out. So chemical produced by them, one of the major chemical is called dopamine. That is not enough, and that causes abnormal movements. When we are walking, our arms swing and we take nice stride. So in Parkinson's disease, that slows down. So person cannot take a long stride. Walking becomes slower and slower, and they shuffle their feet. So they cannot take long step. Then their posture changes. So shoulder rolls over, stooped posture, and then they have a tremor. There are two types of shaking or tremors. One of them is called Parkinson's tremor, and other one is called essential tremor or benign essential tremor. So Parkinson's tremor is usually noticed at the rest. When person is sitting, there is a slow movement go. Or when they are walking, there is a continuous movement. So that is called Parkinsonian tremor. Then there is other tremor when we do something with precision. So when I take my hand to my mouth, nice and smooth, so now it will be shaky. So I will have a hard time then eating soup, for example. I will spill it all over. So that is called benign essential tremor. Similarly, any other activity slows down, so their facial expression are reduced. So as if they are depressed, so there is no movement on their face. Same thing happens with their voice. Voice becomes very soft and weaker. So those are some of the cardinal features of Parkinson's disease. Primarily, it is a clinical diagnosis. So neurologists typically who handles Parkinson's disease. So they will inquire about all the symptoms that I mentioned and then do the brief examination. At the present time, there is no approved test. There is a tremendous research going on in Parkinson's disease. Typically, everybody hears about MRI scan and a CAT scan of the brain, but they are imaging tests, meaning you can look at the brain, but you cannot tell how good it is working. So right now, we don't have a good ability to understand everything about the brain. So now there is a more research is there where now we can what we call functional MRI scan or functional imaging of the brain, or what is called PET scan, PET. So what that means is that we can inject a radioisotope labeled chemical in the vein, let's say for Parkinson's disease, dopamine transporter. So it can give us how dopamine moves across the brain cells. So right now that is being used in clinical trial to understand about the Parkinson's disease, but we do not have ACE test right now to diagnose Parkinson's. Primary treatment is treatment of the symptoms. Then when the tremor is there, particularly for Parkinson's disease, or medicine doesn't work well, nowadays we have some more new thing called deep brain stimulation, Dbs surgery. Neurosurgeon makes a tiny hole, like a penny-sized hole in the skull, and through that insert a thin probe that go into deep part of the brain where we have control of the movement. And then other end is tunneled under the skin and over the chest wall, pacemaker-sized stimulator programmable device is there. So we can program that. So if tremor stops, or their movement improves, or involuntary movement is controlled. So that is called Dbs Brain Surgery, which is one of the things that we are offering at our hospital here. And that is not many places that is offered because it requires specialized setup in the hospital as well as neurosurgeon who is specializing in that kind of treatment.
The progression of Parkinson's disease and the degree of impairment vary from individual to individual, but many people with Parkinson's disease go on to live long, productive lives. For the American Health Journal, I'm Laura Windsor.